Hey, well, thank you, Dylan, and thank all of you calling in from every region of the country. Truly appreciate it. This call is just one of the ways that we build community and solidarity across difference, across regions, and build a true working people's party. So when Mike Brown was killed, and almost 5 years ago, like so many people around the country, especially Black folk, it was devastating. His death and the uncommon courage of the people in Ferguson and St. Louis truly moved many people into action. In my case, I chose to leave my work in New York to do everything I could do in order to help build what became the movement for Black Lives. Now, as we know, in this country, leaving your job also means losing your health care. And it would have been not too easy to follow my calling or to follow my heart's desire towards the movement if I wasn't able to figure out how to make my healthcare needs work. Now, in the past, following my heart has meant I got my healthcare in emergency rooms, as so many people do. I piled up medical bills for routine visits, which took me years to pay off. I'm lucky nothing serious happened during that time that I didn't have healthcare. Now, for far too many Americans, fear of losing healthcare is a major reason people are afraid to follow their dreams. To leave bad jobs or bad marriages, to start a new career, a new business, a new life, it traps people. Eventually, we'll all face illness. And your body doesn't care if you have a great employer or if you have a bad one, if you're in a union or not, or if you don't work at all. But the fight for healthcare has been an ongoing fight for almost a century. During the Depression, President Roosevelt, FDR, planned to include universal healthcare in the original New Deal. Lobbying groups representing hospitals and doctors defeated it. In the 1940s and 50s, much of the labor movement demanded national health insurance. Union leaders knew that if they succeeded in winning a benefit for their own members that wasn't available to most other people, it could become a weapon to divide and conquer. And they were aware that that would be a successful tactic for the bosses. So they fought for everyone. The two biggest steps forward, both incomplete, were Medicare, guaranteeing healthcare for seniors starting in the 1960s, and the Affordable Care Act, also known as Obamacare, which subsidized insurance for many working class people and ended some of the insurance industry's most abusive practices. But that old divide and conquer politics hasn't gone away. If you recall the famous quote, "Get your government hands off my Medicare." Now, some people found the humor in that statement, but there's something worth considering there. If you scratch a little bit deeper to understand the Tea Party subtext there, that to provide healthcare to someone else will come at the cost of what I already have, and it will be used for someone who doesn't look like me. It won't be surprising that in a dozen states that have still refused Medicare expansion, Republican administrations suggest the undeserving might benefit. And you could guess who they mean. Let me put it another way. One of the biggest barriers to universal social insurance programs is racism. Racial animosity, racial resentment, the fear of falling behind in a terrible racial hierarchy where there's winners and losers. Billionaire class politicians know what they're doing. When I was growing up, my mother was a nurse. She was a member of 11. She was a member of 1199, the powerful healthcare workers union. And because of that, we had health coverage we otherwise might not have. While I was growing up, she worked in St. John's Episcopal Hospital in Far Rockaway, Queens, treating addiction and mental illness at the height of the crack epidemic, which ravaged Black communities around the country. I can imagine few starker demonstrations of how health is racialized and pathologized and stigmatized. It was a crisis and our nation ignored it. The same way was true during the AIDS crisis. That's because sometimes in this country, we're taught to think of addiction and disease as an individual problem, or sometimes even as a personal weakness. But health is also social. What kind of food is available in your neighborhood that's also social. And what kind of pollutants you might experience or breathe in your neighborhood, that is political. What kind of jobs are available and what kind of opportunities are available, that also is political. Today, life expectancy is declining in America, while the life gap between rich and poor is growing. Let me be blunter. Poor and working class people are dying younger, but not the rich. We're a wealthy nation, wealthy enough to care for all our people. And that is exactly what's required of us. Anything less is morally unacceptable. But Medicare for All alone won't fix our racial inequities. And in fact, those very racial inequities are a barrier to the kind of solidarity required to pass something like Medicare for All. The only way to get there is to end divide and conquer politics. And the only way we'll end that is with a fierce commitment to solidarity, to stand with each other across race, income, gender, geography, and to demand together what we all deserve. We decide here and now that divide and conquer politics can end, not simply by pointing it out, but we end divide and conquer politics by offering our own politics, a politics of multiracial working class solidarity. This has been a historically vexing goal, and it's our duty today to figure it out at a time when divide and conquer and their politics and the corporate politics of division are at their most organized. Thank you all for giving me the opportunity to share.